Hi, and welcome to Home Care This Week. You know, one of the most challenging things for families and those that have a loved one that is suffering from Alzheimer's or other form of dementia is aggressive behavior. This gets really difficult as a result of safety for the patient themselves or those around them, and it can be really difficult to get past that. When people are doing this, they may, really don't have the skills and the knowledge to redirect people, redirect those folks that are suffering from the disease, and get very frustrated and have a lot of stress as a result, particularly of aggressive behavior. There's no one magic solution to all of this, but as part of the Alzheimer's presentation or Alzheimer's Association's presentations, there is a whole section on dealing with aggressive behavior, and in a recent presentation we went through some of that in the course of that event. So here's a little segment of that regarding aggressive behavior.
Aggression. So aggressive behavior, verbal or physical. It says may occur suddenly for no apparent reason or may emerge following a trigger. I disagree with that a little bit. It always emerges following a trigger. It's just whether or not you know what that is. Okay? This is, yes, it's a disease, but it is actually not a disease that goes and just, for the most part, and in vast majority of cases, it isn't just like a disease that causes somebody to be aggressive. It's a disease that cognitively limits somebody's ability to deal with all these environmental stimuluses. Okay? And then they lash out in an aggressive manner. So there is always a trigger. It's not just like bing, all of a sudden, and they're just, like you see in the movies, and have somebody has to be restrained all the time. That's a whole different deal. With Alzheimer's, it's going to be something is happening there. So it's more a matter of, it's not really suddenly it's for no apparent reason, but there is a reason. So what we're trying to do is put ourselves into their reality and find that reason, and find that trigger. Make sure you're in their reality, so recognizing, okay, they're aggressive, why? What are you mad at? What are we doing? I understand why you're mad, okay? Are you mad? Is it trying to determine what it is, but I understand why you're mad. Let's do something else. Let's punch this pillow. Let's kind of walk over here. Let's kind of redirect it. Rather than, why the heck you'd be mad about, right? It's a different kind of sense of it, but that's the idea. And again, you're not training this person, okay? When you got a child, you're training them to be able to deal with their anger. This person, you're not training them to try to deal with their anger. This is a disease. So it's not going to be something that they're going to have a learned behavior to deal with this. It is redirecting and trying to get past that, not trying to train them into something they're not going to be able to do.